All right, let's talk about something most of us have probably dealt with at some point, conjunctivitis. You probably know it by its more common and much pinker name, pink eye.
We've all been there, right? You stumble to the bathroom, look in the mirror, and bam, there it is. That red, irritated, sometimes goopy eye staring back at you. It's super common, but there's actually a lot more going on than you might realize. So, to really get a handle on this, we've got to look past the nickname. Let's peel back the layers and see what's actually happening from a medical point of view. Okay, so here's the deal. According to the American Academy of Ophthalmology, conjunctivitis isn't really about the color pink. It's about inflammation. See, you have this super thin, clear tissue that covers the white part of your eye and lines your eyelid. It's called the conjunctiva. When that gets inflamed, that's conjunctivitis. This is the key to understanding everything else. A fantastic way to think about this is to compare it to a fever or a cough. It's a giant, flashing sign that something's wrong, but the sign itself doesn't tell you what's wrong. Is it a virus, bacteria, an allergy? Figuring out the cause is the real detective work here. So, this is where it gets really useful. Let's break down the 3 usual suspects, because telling them apart is absolutely crucial for figuring out what to do next. Okay, check this out. On one hand, you've got viral pink eye. Think watery discharge. It's crazy contagious and often starts in one eye before hopping over to the other. Then there's bacterial. This is the one famous for that thick, gunky discharge that can literally make your eyelids feel glued shut in the morning. And finally, you've got allergic conjunctivitis. The dead giveaway here is intense, relentless itching, usually in both eyes. And the good news? It's not contagious at all. So you see, the symptoms themselves are giving you major clues. But here's where the story takes a turn. Pink eye isn't always just a personal, annoying problem. When the contagious kinds start to spread, it can escalate fast. It can go from a handful of cases to a serious public health situation. And this isn't some hypothetical scenario. Let's look at what happened just last year. In the fall of 2023, Pakistan was hit with a massive, fast-moving outbreak of viral conjunctivitis. Just look at that number. Let it sink in. In the Punjab province alone, we're talking about nearly 380,000 reported cases. This wasn't a minor flare-up. It was a full-blown epidemic tearing through the population. And the real-world impact was huge. A number that big means society starts to grind to a halt. It hit kids and working adults the hardest, and things got so bad they actually had to shut down schools to try and stop the spread. It just goes to show how a simple eye infection can cause massive disruption. Okay, so that sounds pretty intense, right? The question is, how do we prevent something like that from happening? Well, the good news is the answers are surprisingly simple, and they work. Honestly, this is the playbook, and it all comes down to basic hygiene. The number one most important thing, wash your hands a lot. And then try your absolute best not to touch or rub your eyes. It's also so important not to share things like towels, pillows, or makeup. These simple habits are our most powerful weapons for breaking that chain of transmission. Now, I want to talk about a really common mistake. It's a knee-jerk reaction that a lot of us have. You get pink eye, you go to the doctor, and you immediately ask for antibiotic drops. But here's the critical thing to understand. For viral pink eye, which, remember, is the most common contagious kind, antibiotics do absolutely nothing. Zero. Using them is not just a waste, it actively contributes to the terrifying global problem of antibiotic resistance. And even with a lot of bacterial cases, the body can often fight it off on its own. The bottom line is, we have to be smarter about this. All right, for this last part, we're going to get into something truly fascinating. We're going to see how sometimes pink eye is actually a signpost pointing to something much deeper. You see, when conjunctivitis just won't go away or it keeps coming back over and over again, it might not be an eye problem at all. It could be a message, a clue from your body about your overall health. And this isn't just some wild theory. Medical experts, including the American Academy of Ophthalmology, have documented these connections for years. A stubborn case of pink eye can sometimes be the very first breadcrumb that leads a doctor to diagnose a bigger, body-wide condition. And the list of potential connections is kind of mind-blowing. We're talking about things like thyroid disorders, sleep apnea, serious autoimmune diseases, the skin condition rosacea, and even shingles. It really proves that our eyes can truly be a window to our overall health. So it all comes back to this one powerful question. The next time you or someone you know has that red eye that just won't quit, maybe it's worth pausing and asking, what is my body trying to tell me? It's a reminder to look past the obvious symptom and listen for the deeper story.